So we're going to talk about if you are 65 or you're eligible for Medicare after being on disability for 24 months, then you don't necessarily have to file for Medicare at that time if you have current insurance through work, yours or your spouse's. It has to be through current work, 20 or more employees, and can't be the Affordable Care Act, can't be a COBRA, can't be a retirement plan. It has to be through current work. So I've got Ari here from Chapter, my Medicare partner, who helps people. They help people throughout the country with all things Medicare, signing up for Medicare supplements, Medicare Advantage, Part D, and all the rest of it. So how you doing, Mari?
I'm doing great. Thank you so much for having me on again.
All right, so you're going to go through all of these interesting forms, and I'm going to chime in there every now and then and give people tips, tricks, and secrets on how to actually get it to Social Security. I've accepted a few million of these forms when I worked at Social Security, so I know all the ins and outs and all the things people miss and how to make sure they don't get penalized for the rest of their life, because penalty is no fun. How much is the, do you want to go over what the penalty is and what we're trying to avoid here?
They're steep. The penalties are steep. There's a penalty for late enrollment in Medicare Part B. That's your outpatient coverage. And there's also a late enrollment penalty for Medicare Part D, your drug coverage. So there's two separate penalties. Technically, there is a third penalty on Medicare Part A. Very few people are subject to it, though, so we won't cover that here.
Yeah, people that are not actually insured, so they didn't pay their 40 quarters, 10 years. And if they want to sign up for Medicare Part A, then they actually have to pay for it. But 99.9% of people get Medicare Part A for free. Well, it's not free. You paid for it ahead of the game, and you're just, I guess you're cashing it in, right?
Cashing it in.
Right?
Well, they paid into it, so it's
exactly.
Theirs.
Exactly. All right. So the penalty is 10% for every 12 months you did not sign up for Medicare when you were supposed to. So if you were supposed to sign up at 65 and you didn't for whatever reason, and you didn't have creditable coverage, then if you end up signing up at 70, you're 5 years late. There's a couple of things that's the issue. Number one is you can't sign up anytime you want. You have to sign up during the general enrollment period, January, February, March, which we're a few days away from that. So, general enrollment period is the only time in the year you can sign up, January, February, March for, Part B. And then you're going to get penalized. If you sign up at 70, that means you're 5 years late. So you get a 50% penalty. And how much is 50% of what, Ari?
50% of the standard Part B premium, which is $185 per month for 2025.
Yep. So you have to pay it. So if it's this year, you pay $185 plus 50% of that. So on top of the $185. And this is different than the IRMAA. There's a lot of people that pay a extra Part B premium for Part B and Part D, and that is something separate. So you want to kind of differentiate those two for us?
Yes. 90% plus of Americans pay the standard Part B premium, which is $185 per month for 2025. If you're a high earner, you're subject to two high earner taxes. And the Social Security Administration calls this IRMAA, the Income Related Monthly Adjustment Amount. So who is subject to IRMAA? Well, for this year, looking at your 2023 tax return, so it's a 2-year look back, if you earned more than $106,000 per year and are a solo filer, then you're subject, and Ed, thank you for putting up that one pager. So if you're a solo filer and if you earned $106,000 or more, then you are subject to the high earner taxes. What if you're a joint filer? If you and your partner earned $212,000 or more, then you're subject to IRMAA. And you can see it adds quite a bit to your Part B and Part D if you are subject to those. Now, if you're a very high earner, then you're probably going to be in one of the top 3 brackets, and they get pretty aggressive in the top 3. But if you only earned a little bit more than 106,000 or 212,000, then it's an escalator. So it's not as if you get to that bottom bracket just because you earned a few dollars more in 2023 than 106K or 212K. If you want this one pager, by all means, we'd love to send it to you. So if that one pager would be helpful to you to see if you're subject to the 2 Medicare high earner taxes, you can just give us a call at the number Dr. Ed displayed.
Perfect. All right. So we're not talking about the IRMAA there, which Ari, someone just said, and by the way, this is also live. So if you've got any questions, make sure you type them into live. But Teresa said she loves Ari. So you've got a fan
Thank you,
out there.
Teresa. That's very kind of you.
All right. So there's a couple of ways. Okay. So if you're going to go ahead and sign up for the special enrollment period, that is, you had health insurance from current work, yours or your spouse's, 20 or more employees, and then all of a sudden you're going to stop working. You're going to stop working this month or next month or 2 months from now. Great. Then you are eligible for that special enrollment period where you can sign up for Part B and Part D with no penalty whatsoever. But you have to prove that you actually had health insurance from current work, and that's what we're going to talk about today. So there's a few ways you can do it. So what are some of the ways they can sign up for it?
Well, the easiest, fastest, and most secure way is by using your online Social Security account portal. So if you have access to your online Social Security account portal, that is going to be the fastest way to start your Medicare benefits. And there, if you're past age 65, the only thing that you'll need in order to use the Part B special enrollment period that Dr. Ed referred to is Form L564. You'll need your employer or your spouse's employer to fill out Form L564. And Dr. Ed helpfully has screen shared it.
All right. So this is basically not to sign up, but this is the form to avoid the penalty. So you're going to need this whether you go online to sign up for Part B or whether you call and schedule an appointment. Well, which you also still have to go down to the local Social Security office if you can't get online. Starting March 31st, there's a new policy that you have to go in and ID yourself to a local Social Security office if they happen to still be open in your neck of the woods. But this is the form, the 564. This is the one that avoids the penalty. And the top part, pretty easy, names employer. You just take this down to HR and HR fills it out. The important thing is if you are 70 years old and you've had health insurance since you turned 65, so you did the smart thing and refused Part B, then that's fine, but you need to prove that you actually had health insurance from current work since you turned 65. And so if you had the same employer since you turned 65, you take it down to that employer and you fill it out. And they fill it out. They fill it out and they sign it and everything. They give it back to you and you submit it. If you had 2 employers, then you'll need 2 of those forms and you need to take one down to each employer to get those filled out.
Yep. And Dr. Ed, some people are hesitant about asking an ex-employer to fill out Form L564. You shouldn't be. They are legally required to get this form back to you. So even if you ended on not so great terms with your ex-employer, you should have no hesitation about requesting them to fill out this form.
Perfect. And so if it's like a husband and wife situation, you'll need 2 of these forms. And you can see that it has, the applicant's name and the employee's name. And what that is, if it's just for you, then, pretty much the same. But if, let's say, the wife had health insurance, she was the one working, then she would be the employee and the husband would be the applicant. So you would put the husband's Social Security number as the applicant. She would just have a separate form that says, hey, she's the employee and she's the applicant herself. But if it's from the wife's work, the employee's name and the Social Security number would be the wife and the applicant would be the husband. And you want to go over the rest of the fun details on this one, Ari?
Yeah. So you fill out Section A, your employer fills out Section B. So depending on who the employee is, that's how you would fill out L564. And if you and your partner are on your work provided coverage, then you would want 2 copies of this form, one for you, one for your partner. And you would fill out Section A accordingly. Then your employer fills out Section B. In Section B, Dr. Ed, let me pull up my copy of it because I'm having a little trouble reading yours.
And one of the things that, so if once you get this, there's several ways. If you go through the portal, you can actually upload this through the portal. If it's working, I guess the system has been down a few times over the last week or so. They're having issues. They essentially fired all the people keeping the computer system together. So we'll see what's happening there. But you can upload it in your portal. You can fax it. Yes, Social Security still uses faxes. So you can fax it to your local Social Security office. And where do you find the fax number? You just go to the, I think Ari, or you go to
Yes.
SSA. Yeah.
Yeah. To fax it, you would go to ssa.gov/locator. You'd scroll down and say locate an office by zip. It's the blue button that says find an office near you. You'd enter in your zip code and then the fax number. Use that fax number in order to send your completed copy of L564. The other way to do it is if you're applying for Part B through your online Social Security account, you can scan this form and upload it as part of your application.
And I got it. Here's part of the tips, tricks, and secrets are from the inside. If you go ahead and fax it, I would always, anytime you fax anything, always find a fax that has the confirmation receipt that it actually went in, and then it goes into a paperless system, which
Who
I helped
created that
design.
paperless system?
Yes, I helped design when I worked at Social Security Administration. So the paperless system that it goes into, any document that goes into Social Security, whether it's faxed, you walk it down, you mail it in, goes to this paperless system called WorkTrack, and which is a great system. I got to pat myself on the back for any, but the limitation is it's in the system, but then a human being, an employee at Social Security actually has to look at the document and take action on it. And that's where the chain kind of falls right now. Is there are going to be a lot of people. Ari was we were talking before we started here that a lot of people are not getting their Medicare or anything, retirement benefits or survivor benefits, started on time, and they're missing checks. And in this case, they're without health insurance, and they can't see their doctor, and they can't get their prescriptions because they don't have health insurance for a month or 2 months or 3 months because they stop working, and the company shuts down all of a sudden, or you get sick all of a sudden, or you just get mad at your boss and you say, I'm out of here. And then, you lose your health insurance. And because Social Security is so understaffed right now, it's going to take them a lot longer than normal to process this and anything else. So it's extremely important that if you want your Medicare to start like the next month, then probably the best thing is, rather than fax it or anything like that, is maybe go online. But even better than that is going to a local office and saying, hey, I just got torqued off at my boss and I told him to take his job, and well, you know what? But now I don't have health insurance in a couple of days and I need my Medicare to start, in 3 days. So take it down there and tell the employee, once you get in line there and get to a window, hand those forms. There's 2 of them. We'll go over the other one here. It's called a 40B. That's the one actually to sign up for Medicare. You give them the forms and you tell them, please, this is dire circumstances. I can't lose my medication. I can't lose my health insurance. I got a doctor's appointment in a couple of weeks. Please process it right now. And they can go into the system and they can input it right then and there. and then Medicare will process it and you'll have your Medicare card on the way. One of the issues is, Medicare cards come, old snail mail, and it might take you 2 weeks or so. So if you have something dire need, you'll need your Medicare number. You can go online, you can call Ari and his team, because you all have access to the Medicare system and you're able to find those numbers quicker, correct?
Yes, yes. And we can actually set up a reminder so that once it's approved by Social Security, we can call you and let you know that you've been issued a Medicare number, which is faster than relying on snail mail.
Perfect. So you'll have the Medicare number, and because once you sign up for, Medicare Part A and Part B, that's fine, beautiful, that's the start. But then you've got all of the gaps, Medicare Part B, the 20% gap, and the deductibles and the co-insurance and all the rest of it. So Medicare supplement plans, Medicare Advantage plans, Part D prescription drug plans, Chapter can help you out with all that, and 100% free, right?
No charge.
No charge. All right. And you do it all 50 states and the District of Columbia.
Indeed.
All right. So let's go back. Some of the things just ignore. 99.999%. I've seen about 1 million of these forms, and this little section here for hours bank arrangements only, I've never ever seen anybody fill that out or apply to anybody. So don't even don't even worry about that. Yeah.
So the key thing is, this is a one-page form. You fill out section A, your employer fills out section B. And when your employer is filling out section B, if you've been on yours or your spouse's work provided coverage, they would check yes in question 1. In question 2, they would say when the health insurance began. The answer to number 3 depends on whether you or your spouse have already left the employer. So either yes or no. And then the date the coverage ended, and along with the dates that you or your spouse worked for the company. Then, crucially, the company official signs at the bottom of the form. So signature, title, that is for the company official. It can be the CEO, it can be the benefits director, it can be the head of people, it can be the head of HR. Depends based on the company where you worked, who that person who signs this form is. But they should get it back to you fairly quickly. Sometimes I even see same-day turnaround because, again, the employer is legally required to return this to you.
All right, great. So this applies if you waited till after 65, or you were on disability benefits and you were eligible to receive Medicare after being on disability for 24 months. Then it's the same type of situation. You have to fill it out based on after you were first eligible for Medicare. You didn't enroll in Medicare because you or your spouse, usually it's a spouse type situation, had healthcare. So you just have to fill that out in that case. Anything else on the 564? This one's pretty easy considering you get it done for you by your HR, right?
Yep. And if you are applying for Medicare by way of disability, then question number 6 would pertain to you under section B. Just wanted to note that.
Perfect.
Otherwise, you're good to go as long as you have this form completed. And as Dr. Ed mentioned, this is for someone who's either applying for Medicare by way of disability or applying for Medicare and is working, or their spouse is working for an employer, or it's for someone who's beyond age 65, which is by far the most common use case for this form, L564.
All right, so let's go into the other one. So that's the one we just talked about is the one to avoid the penalty.
Yes.
If you didn't have health insurance from work and all that, then you don't even have to fill that one out because unfortunately, you just might have to pay the penalty if you're looking for this special enrollment period. So this is the one to actually sign up for Part B. So you'll need both of these forms, 564 and the 40B, if you had health insurance from current work. And go for it, Ari. It's all you.
Yes. Okay. So you can either upload your copy of L564 when you're completing your online application to enroll in Medicare Part B, or you can apply by paper. And so if you were to apply by paper, then you would need L564, which we just went over, and you would need a copy of Form 40B. And so what Dr. Ed is going to share is 40B. This is the other form you would need if you're applying for Part B by way of leaving yours or your spouse's work-provided coverage.
All right, so this one's pretty easy. Your Medicare, again, this is if it's a husband and wife situation, then you just need two of these forms. So if it's a husband and wife situation, you need two 564s and you need two 40Bs to cover each particular person.
Yep, there's no family form. That goes for L564, 40B, when using your online Social Security account portal or appealing your IRMAA. There's no family form that covers you and your partner. You each need to fill out a copy.
Perfect. All right. So pretty easy here. The mailing address, city, phone number. Do you wish to sign up for Medicare Part B? Yes, that's kind of the whole purpose of the form.
That's why we're doing the video.
Yeah. Do you currently have?
If you're not applying for Part B, don't send this form to Social Security.
Yeah. That was always this kind of a dumb question. But I'm sure that with everything Social Security, there's exceptions. The exceptions. I'm sure. Yeah. Anyway, so. Do you currently have or did you have coverage through an employer or union group health plan? If yes, complete 7C. All right. So this is a brand new form that just came out recently. And if you're using a previous form, don't worry about it. We've got one form here that was issued January 2024. And any one of the new ones or the old ones, whatever you find online, that's a 40B or a 564, you can pretty much use anything. But you have to make sure you add a couple of things in there to make your life a lot easier. And we'll go in there in a little bit.
Yeah. And that's a really good point, Dr. Ed. We're taping this video today, March 25th, 2025. If this form is updated next month or sometime over the summer, just do a quick Google search and see if there's a more recent version of the form than the one we're going over in the video. But this is, as of today, the most recent copy of 40B that the Social Security Administration has published. And that's true of all the forms that we're going over today.
In my office, we produced our own 40B and stuff like that. We added some remarks to make it a little bit easier for people to understand. So we made a packet of a 40B and a 564 with a little extra thing on there because a lot of people miss things. So
yeah,
we had our own version. So
yeah,
but
we'll give you some takeaways at the end of the video as to which forms you need in order to accomplish what, depending on how you're starting Medicare.
Okay. All right. So enter the dates of employment or volunteer work health coverage below. Again, this is kind of repetitive if you're also including the 564 in there. Has an employer, health insurance provider, or other entity requested or required you to enroll in Part B? What's the mentality behind that particular question?
Well, some small group insure. So, Dr. Ed, the people who are eligible for the Part B special enrollment period are those who are coming off active, large group work provided coverage. That means 20 employees or more. 20 employees or more at yours or your spouse's employer. For someone who works for a small employer, which is 19 or fewer employees, that's what question 8 would pertain to.
Okay. All right. And people are probably kind of getting a little glassy-eyed now with all these forms and the different exceptions. The easy way to do it is to call Ari and his team and say, hey, help me fill out the form. And they'll help you fill out the forms. They'll send you the forms, walk you through the whole thing, set up a reminder for when your Medicare number comes in, set up a reminder to call them and walk them through the rest of the Part C and the Part D and the supplement and all the rest of it, correct?
Yep, that's totally accurate. And also, I just want to mention, I see some questions from our viewers that are asking, what if I'm already on Medicare? Do I need to fill out any of these forms? The answer is no. Just make sure that you're paying your Part B premium to Uncle Sam. The easiest way to do that is through Medicare Easy Pay if you're not taking Social Security. And if you are taking Social Security, good news, the government deducts it straight from your Social Security check.
Right. And people always ask, they say, I'm not sick. I don't want Medicare. Why are they going to penalize me later? Well, it's insurance, just like car insurance. I don't intend on having a car wreck this month. So why do I need car insurance? Well, it's to pay for all the people that are going to run into other people this month. And so, yeah, it's the same nature of insurance, correct?
Yes, that's totally accurate. And I would caution against that mentality. If someone is past age 65 and they've delayed signing up for Medicare and they don't have work provided coverage from an employer that has 20 or more employees, then you have 6 days left in order to activate your Medicare for this year.
Yep. So, yeah, so reach out to Ari and his team there. They'll walk you through the forms, make sure you fill it out correctly, show you how to get it all set up. And then once you're signed up for Part B, do they still have that deadline of March 31st to go ahead and sign up for a Medicare supplement or prescription drug plan or anything like that? Or are they good for a little bit?
No, I would encourage someone who's in that camp where you need coverage to begin April 1st to really think about what type of additional coverage. There's only two. Dr. Ed has mentioned both of them. One is Medigap, that sits on top of original Medicare, and it covers the 20% you would otherwise owe out of pocket. This is the most comprehensive type of insurance, and it's networkless. The other option is Medicare Advantage, which is a replacement for original Medicare. And whether you choose option 1 or option 2, that is Medigap or Medicare Advantage, it's important to walk through the trade-offs of either, but understand that what we're talking about today just gets your Medicare started. And if you only have original Medicare, then you still owe at least 20% of your medical expenses out of pocket. So it's not comprehensive insurance. And what's more is it doesn't give you drug coverage. So you could fill out these forms perfectly. You could have your Medicare start, but you still wouldn't have drug coverage because that's separate from what we're going over today.
Good point. Good point.
And then you'd still have that Part D late enrollment penalty.
And a lot of people that, if you sign up for a Medicare Advantage, most of those have a Part D prescription drug bundled in them. A lot of people I see make a mistake is they sign up for a Medicare supplement plan and don't realize they also have to get a Part D plan. And people, unfortunately, there's people that help you with Medicare out there. They sign you up for a Medicare supplement plan, and then people say, well, I don't need a prescription drug plan because I don't take any drugs. And the agent or the broker says, oh, okay, well, don't care. I don't make any money on that, so I don't make a commission on that, so I don't care. Bye. And then a year, 2 years, 5 years later, when you actually have to take some type of medication, guess what? You can't sign up until the general enrollment period, and then you're also penalized.
Yeah, they wouldn't be able to sign up until the fall during the annual enrollment period if they miss their opportunity to select drug coverage, and they would owe a not insignificant Part D late enrollment penalty unless they've had coverage at least as good as what they would have received from Medicare Part D.
Right. So, yeah, unfortunately, a lot of penalties, a lot of different enrollment periods. You can do it here and you do it there. Anyway, so, all right. So the another tip, trick, or secret is on the 40B. I never know why they never included this. That's why we made our own version in our office. In number 9, their remarks. Put down when you want your Part B to start. Please
1,000,000%.
start Part B, April 2025, May 2025. That way, one health insurance stops from work, and the next day your Medicare Part B and everything starts, without any issues. Because you know what happens when you go 1 month without health insurance for the past 20 years. That's when you fall or someone gets sick or something. So.
And this is such a good point, Dr. Ed, about using the remarks section to alert Social Security when you want your Part B to be activated. We were helping one of your viewers who was trying to get ahead of their Medicare enrollment process, and they're actually they're ending their employment at the end of this week, but they're using their work provided coverage is extending until the end of April because they're using vacation days to bridge. and their employer is having them end their employment at the end of April. So their insurance terminates at the end of April. But they wanted to get ahead of activating their Part B. But we don't want them to double pay for insurance, and they're certainly entitled to use the Part B special enrollment period because their employer has 20 employees or more. So here they would use the remark section to state for a May 1st Part B effective date.
Sorry about that. Someone's asking for your phone number, so I just popped it up there in the comments. So someone in the comments also said that they were denied for Medicare Advantage.
Would need to know more about
68 years old. Yep, still denied for Medicare Advantage.
Yeah. We are
Yeah,
in the Medicare Advantage open enrollment period that ends in 6 days. So I would be curious whether you may have already used this period in order to review your coverage and switch to a different plan. That would be what immediately comes to mind.
Yeah, so it's a 5-acre farmer. Okay, 5-acre farmer. Yeah, call the number there, Ari, and his team will figure out what the heck's going on. Yeah, usually you're not it's not like a Medicare supplement plan. You can be denied in most states for a Medicare supplement plan, based on health underwriting or when you're hoping to enroll. But a Medicare Advantage plan, usually it's just a timing issue more than anything else. All right. One last thing on this form is people always say, well, I can't fill it out because I don't have anybody that can witness my signature. You don't need, that's only if it says right here, it says, if you cannot sign your name and you can only sign your name with an X, and this is on almost all Social Security forms, it has this little thing about a witness. And is if all you can do is an X, then you need a witness. But if you can actually sign your name, I think my signature actually looks like an X, so maybe I should start getting a witness to say. But if you can sign your name, you don't need a witness. Just sign it and date it and send it in.
And you can send this in with your copy of L564. So if you are using the Part B special enrollment period to activate your Medicare, you would take your copy of L564, your copy of 40B, and you would fax it to your local Social Security office, or you can bring it in person, or you can send it by certified mail.
All right. Since we got a lot of people watching right now, and I'm going to be doing another video probably maybe later today or tomorrow about this new policy starting April 1st that supposedly some people think everybody has to go down to the Social Security office in order to continue benefits. That is not the case. The only time you need to go down to Social Security is if you're not able to do everything online. Provide your ID yourself online for new claims, or changing your direct deposit. That is the only reason anybody should have to go down to a local Social Security office with this new policy. So I'm going to do another video on that probably in the next 24 hours because unfortunately, I think Social Security, there's going to be April Fool's Day. Could you imagine 73 million people going down to Social Security on April 1st?
Oh boy, if their local Social Security branch is even open.
Yeah. So,
Dr. Ed, we have some great comments that are coming in. The first question from Ralph is, what happens when you forget to fill out the remarks for the date you want your Medicare to begin on Form 40B? When this happens, they will just assume that you wanted it to start the first of the following month. So if you were to apply using if you were to fill out 40B and L564 and send it in, and you don't put anything in the remarks, they would date your Part B to April 1st because we're still in March.
Okay. Or if they don't assume, which depends on the office, I had always told my employees in my office, never assume anything. You have to reach out to the people and say, hey, we got your forms and I'm about to process it. When did you want it to start? And so that delays everything. So yeah, it really depends on the office. So Cindy, does Ari chapter do Plan N and Plan G?
Absolutely. Plan N and Plan G are types of Medigap. These are Medigap plan letter types, and each plan letter type is standardized under federal law. So Plan G is standardized, Plan N is standardized, Plan F is standardized. However, the price varies enormously within a given letter type. And so that's exactly what will help you evaluate.
Yeah, my son and I would have never chosen Chapter if y'all didn't do Medicare Supplement Plan N and G, because everybody knows that regular viewers know that those are the ones I recommend first. Plan N, G, either one of them. I'm kind of partial to N because I'm cheap like that, but either one of those is fine. But most people, it's a budget issue. But please check out N and G first, and if it's just not for you, because if it's a budget issue, then Medicare Advantage and Chapter can help out with that as well.
And then, Dr. Ed, there's a comment from Big G who says COBRA is not creditable coverage. And that is such an important point. It's a great comment. Thank you, Big G, for putting that in the comments. That's absolutely correct. COBRA is not creditable coverage for the purpose of delaying enrollment in Medicare. And it also would not count as primary insurance. It would only be secondary to Medicare, which means you have to activate your Medicare.
What about VA coverage? VA regular VA coverage versus Tricare.
Great distinction. Tricare for life is for retired service members. That means they served our country for 20 years or more, or their spouse is using Tricare. And for Tricare, you still need to enroll in Medicare Part B, but then the government, the Department of Defense specifically, provides for your Medicare supplement and for your drug coverage. So the only thing that you need to do if you're a retired service member or the spouse of a retired service member is activate your Medicare Part B. That's it. You don't need any other type of additional coverage. You're done. Now, let's talk about if you're a veteran, but not a retired service member. So if you're a veteran, you have the option of using the VA for your health benefits, for your medical benefits. They also offer prescription benefits through the VA. However, if you want to use a facility outside the VA, and many veterans do, because they might not be near a VA facility, or they might not like the care that they receive at that facility, or they might like to travel, then you need to sign up for, or at least consider signing up for Medicare, because you are going to be subject to the late enrollment penalties that are the subject of this video. It is not creditable coverage to rely on the VA in lieu of signing up for Medicare Part B. So that would not be a valid reason for a Part B special enrollment period.
Yeah, and I've told, being an old Marine Corps veteran myself, the changes coming to the VA, they're talking about, firing 83,000 people. And, people up until now that have been using the VA that are happy with it, so they decline Part B because they're happy with the VA, that might change in the future. So it might be a good idea to check out your options, and you've got, 6 more days to sign up for Part B. You just might have a penalty, but at least you'll have some type of coverage in case the health care provided at your local VA goes south. So you got 6 more days to do that. And there's options out there to kind of have your cake and eat it too. The Medicare Advantage Part B give back plans, which kind of pay for all or part of your Part B premium. Not the penalty part, but at least some of it.
Yeah, and a little data here from the Social Security Administration. The majority of veterans choose to enroll in Medicare, so that way they have optionality. You have the flexibility to go to the VA for the care that you're comfortable receiving there, or if you're near a great VA facility where you have an established relationships with the doctor, you also have the option of going outside the VA, because then you also have Medicare.
Perfect. Let me see. Diana asked, if you wait until full retirement age to take out Part B, is the supplement plans more expensive?
The answer here, there's a technical answer and then there's the short answer. The short answer is, in 46 states, you have a Medigap open enrollment right, which is the 6 months after you start Medicare Part B. And so, no, a supplement insurer would not be allowed to charge you more if you sign up during that 6-month Medigap open enrollment right, which is the 6 months after starting Medicare Part B. So the answer is no. There are 4 states that allow you to sign up for a Medicare supplement plan without any questions about your health history. And those 4 states are New York, Connecticut, Massachusetts, and Maine. So if you don't live in one of those 4 states and you know that you want a Medicare supplement plan, then you ought to consider signing up within 6 months of starting your Medicare Part B. So that way, as Diana's question references, an insurer can't ask you questions about your health history and can't charge you more.
Yeah, perfect. Sally, for open enrollment, if I apply online within the enrollment period, I am on time, or is it dated when it is processed? No, it's dated when you essentially submit the forms. So whenever you submit the forms, that's the date they use. So not when they process it, because unfortunately, now, they probably won't process it for a month or 2 months or something. So if you send it in March and they are not able to get to it till April or May, they will process it, and let's say in May, but they will backdate it to March. So if you have a doctor's appointment and at that time you don't have your Medicare started, but then they start it later and backdate it, then you just have to resubmit those doctor's bills to Medicare and they should take care of it, correct?
Yes. Now, if you applied this month, your Medicare wouldn't begin until April 1, but any bills that you collect during April, even if your Medicare isn't issued, even if they don't get to your application, as Dr. Ed is mentioning, until May, we will help you submit those claims to Medicare to make sure that you get reimbursed. And that's part of our ongoing commitment to you and what we offer through our member support team, which is you have a Medicare advisor and you have our member support team. So you're supported by 2 teams here at Chapter in order to help you navigate your healthcare.
Perfect. And that's why we chose you all, because you got, a lot of people, they sign you up and they buy, and never talk to me again until we, come up with something else. But the member success team that y'all have are awesome. So,
Can I say one more thing?
sure.
If you're on a high deductible health insurance plan and you contribute to a health savings account, then you have a timing issue as to when to discontinue your HSA. Because if you're past age 65, then the Social Security Administration is going to backdate your Medicare Part A by up to 6 months. And that's automatic, right, Dr. Ed?
That is correct. Yes. And Social Security employees don't know that, well, because it's an IRS issue. Social Security, it's not their issue. So a lot of Social Security, when you sign up, they don't tell you, hey, are you given to an HSA? If you're contributing to an HSA, IRS, you and the IRS are going to have a conversation when you file your taxes next year. And that's an IRS issue. It's not a Social Security issue. So a lot of people sign up for Part A while they're contributing to an HSA. And you can make withdrawals from an HSA. You can have an HSA when you sign up for Part A, but you can no longer contribute to that HSA up to 6 months before you start your Part A.
And I don't want to sound anti-health savings accounts. They're an amazing retirement savings vehicle. I contribute to one here at Chapter. As Dr. Ed mentioned, you can use all the money you've saved in your health savings account for any qualified medical expense. You can even use it if you're a high earner. You can even use it to pay your Part B and Part D IRMAA surcharges. The only thing you can't use it for is to pay the premium for your Medicare supplement plan.
Okay. All right. Looks like we found a 5-acre farmer. I'm that person, 68, refused because my previous plan isn't providing anymore. Still denied Advantage plan. That sounds like it's they got out of a previous plan probably since January 1st. And then because they can only make one switch during the open enrollment period, January, February, March. You can't switch twice, correct?
Right. I don't want to speculate. I think this person would benefit by working with an independent, unbiased advisor to see if there's another election period they might be able to use to get on the plan if they're choosing.
All right. If you don't mind, I'm going to get to just a general Social Security question here. I'm 62, called to file for divorced spouse benefits, was told I'd get a call within 2 weeks. No call. Called daily with no response. I live 200 miles from a local office. How do I file now? Call your politician. and say, hey, what's going on? If this becomes a congressional, it goes through separate channels. And hopefully, I know exactly what happened is the offices, they schedule appointments like a month or 2 months out. So they look at, how many people they're going to have in office 2 months from now. And that's how many appointments they open for 2 months from now. Your office, probably the person that had your appointment is no longer with the agency. They were voluntold to remove themselves from the premises or fired or early out or whatever the case may be. So yeah, I see a lot of this, unfortunately. So
Dr. Ed, would you mind
yeah,
putting up Cool Chris 66's question?
sure. Let's see here. Is it further on down? I got so many. Cool, Chris.
I can also read it off.
Okay, yeah. If you don't, okay, there we go. Yes, go for it.
This is such an awesome question because it weaves together information throughout the video. And Chris, the answer is yes. Right now, we're in the Medicare Advantage open enrollment period. It ends in 6 days. It goes until the end of March. And your parents can use the Medicare Advantage open enrollment period to switch from their Medicare Advantage plan back to original Medicare and sign up for the Medicare supplement plan of their choosing because they live in New York, which has guaranteed issue, and to sign up for standalone Part D prescription drug coverage.
Perfect. And Mark asks, I saw on form an expiration date upper right. Is the new form identical or been Trumpified? It's all the same information. So it hasn't been changed based on any political party being in office. So it's all pretty much the same type of information. So like I said, that Social Security, once you get those two forms, you submit it to the Social Security office, and they are looking for, a couple of points, your name, address, Social Security number, when you started, when you stopped healthcare, when you want Part B to start. So, you can use a form from, last year, 2 years ago, 5 years ago. It's pretty much all the same. So it won't be an issue. But the most important thing is on the 40B, on the remarks, make sure you put down there when you want your Part B to start.
Dr. Ed, I have a question.
Sure.
If someone is having trouble just using the online Social Security account portal, is there a way that they can request their Medicare Part A from Uncle Sam?
Yeah, you just have to, if you can't do it online, then you'd have to schedule an appointment or go down to local Social Security office. Some offices now are, not accepting any walk-ins whatsoever, but with the new changes, it's kind of the Wild West out there. But I talked about this yesterday. There is a policy that's still in effect that if this is kind of a dire need or congressional or you're homeless or, in this particular case, if you're going to be losing health insurance, that's a dire need. So if for some reason you're going to lose health insurance in a few days, then you go down to local Social Security office and say, hey, I need to submit these two forms and I need them to be processed immediately. And if the guard, these are contracted guards, they don't make policy, they're not part of Social Security, they're part of the FPS, Federal Protective Services. So they're just giving orders by Federal Protective Services to protect, the people in there, the visitors and the employees and the building and whatever. So they don't know anything about policy. They shouldn't be giving any policy type stuff. But just tell the guard, this is a congressional, and according to Social Security policy, you have to let me in. And if it's not, then there's going to be issues. And they'll let you in, and you grab one of those tickets or whatever the case may be in the VIP kiosk, and then you get it processed right then and there.
Really good question from MG Steele. Asks, what if you're retiring? Oh, great. You already have it up.
Yep.
So if you're retiring in May, first, congratulations. It'll depend on whether your work provided coverage is going to the end of May. Then we would want your Medicare to begin in June, so you're not double paying for insurance in the month of May.
All right, let's see. My husband is a postal worker, 70 years old, but he's not ready to retire yet, but I'm ready. He likes to sign up for an Advantage, and I prefer Medigap. What do I need to do next? I faxed the form into HR.
I mean, another congratulations. We have a lot of people who are planning to retire in the near future. So kudos to this viewer on their upcoming retirement. And the answer is it's going to depend whether you want to be on the postal worker retiree benefit plan. They just announced some changes that are going into effect, and I would encourage you to evaluate whether you want to remain on the postal worker retiree benefit plan. And you have a few options here. One is what you already mentioned. It sounds like your husband is going to choose a Medicare Advantage plan. However, in your case, if you're going to opt out of their postal worker retiree coverage, then you're foregoing the opportunity to ever go back to that postal worker insurance. So it's a big choice to make. And I would encourage you to talk through it with someone, either Dr. Ed, it's on the tip of my tongue, but I can't remember. The government has a special, the OPM, the Office of Personnel Management, would be able to talk through the decision with you, or you could work with an independent, unbiased advisor, and they can help you evaluate the pros and cons of opting out of the postal worker retiree coverage.
Yeah, and postal retirees are different than any other OPM type federal employee health benefits, regular. Yeah. So they change it to what effective this year, last year, was it 2025 or last year? Now it's mandatory to have Part B. For other federal employees, it's not mandatory to have Part B, but postal workers, it is mandatory, right?
It is if they're not yet 64. And so this comment falls into an interesting bucket because the husband is 70. And so for those who are 64 and up, they're technically not required to take Medicare Part B, according to the regulations published by the post office.
Let's see. One of many got Social Security last December, but do not have any coverage at all. They said they would call, but no one has. Oh, that's not good. So for people that, that doesn't apply to, the special enrollment period and, because you got work and everything, 65. But if you are, let's say 64 years old and you're currently receiving Social Security benefits, then about 100 days before you hit your 65th birthday, Medicare will send you your package in the mail. So one of many, if you're getting close to your 65th birthday, you should be receiving that package in the mail from Medicare automatically with your Part A and your Part B card in there. So if you didn't, then it must have got it lost in the mail, or, at 65, there's data brokers out there that sell your information to everybody and their mother, and everybody knows you're turning 65, and they all want to take you to the turning 65 Medicare prom dance. And so you get tons of junk mail, and some of it looks official. So people could just get inundated with phone calls and junk mail. And sometimes, anytime they see anything with Medicare on it, they immediately throw it in the garbage. And unfortunately, some people throw away the actual Medicare package with their cards in there. So hopefully that's not you. But yeah, if you're getting close, maybe, you got it and you just didn't get to you, you can call Chapter and Ari over there, and they can look in the system and possibly find your Medicare number for you and get you set up with everything else.
Doctor, I had a great question from Mark Swanson. He has a bill that's due today for Medicare Part B. So Mark, you got to pay this bill. We don't want your Part B terminated for non-payment. Two ways you can pay. You can put the check in the mail today, or you can go and set up a Medicare Easy Pay account through Medicare.gov. So you can create your online Medicare user account and pay the bill through Medicare Easy Pay. That's the government's name for auto pay for Part B, IRMAA, you name it. So Medicare Easy Pay would be the fastest way it would be a fast, secure way to pay this bill today.
All right. And for those people that pay that way and then they start their Social Security monthly benefits later, you're probably going to be paying twice for a month or two, because you send in your check for the 3 months or whatever, and then Social Security starts taking out of your check. Don't worry about it. It'll come out in the wash. So if you pay an extra $185 for a month or two, it'll be credited to your account, and then it'll be returned to you. So I've never seen that not happen. So
Yes, they're very good about payment reconciliation for the purpose of paying your Part B or your IRMAA.
all right, Diane, what happens if you're on original Medicare, SSI, and Medicaid? If I change to a Medicare Advantage plan, my hospital or doctors in my town don't take it. What should I do?
You should not sign up for a plan that your providers do not accept. That would not be the right coverage for you. Full stop.
Yeah, I like it. I like it. Yeah, that's if you have Medicare, Medicaid, some doctors and hospitals and clinics just like working with Medicaid. I know a lot of, if you've got like any type of home health care, and you see some advertisement on Facebook that says, hey, there's a $100, $200, $300 grocery card, free ice cream and unicorns for life. Call us up, and you call them up, and they want to push you into a Medicare Advantage plan, and they say, oh, don't worry about your home health care, won't be affected. Stop. Full stop, as Ari just said. If you really want that $100, $200, $300, grocery card, which they do exist, but it really depends on your particular area, talk to your home healthcare people first and say, hey, that $200, that's really gonna help me a lot. But I don't want you to stop coming out and helping, doing, whatever, home healthcare type stuff. So definitely check, because a lot of them will say, yes, we take that, but we really don't like those. We've got a limited number of staff, and we like people with just Medicaid only, Medicaid and Medicare only. And so if you do the Medicare Advantage, it takes a long time to get billed, and they might not pay as much, and yada yada yada. So unfortunately, we're going to have to stop coming out and helping you out. So the number one thing is your health care and taking care of the total picture, rather than getting some Medicare insurance agent out there a commission, correct?
It's the whole reason we started Chapter in the first place. The incentives in Medicare land are screwed up, and you have captive brokers who are only showing you the plans that they represent. Instead, you deserve to evaluate all of your options. And if there isn't a plan available that would cover all of your doctors or all of your prescriptions affordably, we'll let you know.
Perfect. I like it. So, can you sign up for Part B online? I don't think you could. I thought it had to be in person. I already have Medicare but health insurance through work.
Yes, you can sign up for Part B online. In the event that you go online, you need an online Social Security account portal. So if you don't already have one, it should be easy to create. And then you would fill out the flow to sign up for Part B, and you would upload a copy of Form L564, which we covered earlier in the video, if you're past age 65.
Here's a near and dear one to my heart. Carlene, those kiosks, the VIP kiosks, are a joke. They don't ask the right questions of what you're needing. I had to start over again because the person told me he couldn't cut in line. Pain. Yes, in my office, third business in the country, we got rid of those kiosks because they were completely useless, and people used to play Space Invaders on there and say, okay, well this number, this category seems to be going faster, so they go up there and get another ticket, and I got slapped on the hand for getting rid of the kiosks, but we were one of the most efficient offices because we got rid of them, but they brought them back. Yeah, they're useless. So anyway, so sorry, that's a pet peeve of mine, of those kiosks at an office. If it's a small office, then fine. But yeah, anybody that has more than a few hundred a day, then yeah. All right, sorry about that. I go off into that tangent. Anyway, what if we are already receiving A and B and now 67? Do I still need to worry? Accident, frozen shoulder not healing, so I apply early retirement. I was 63 then, and my retirement was 66.
So you already have original Medicare. That is Part A and Part B. That's a good start. Again, that's not comprehensive health insurance. It still leaves you paying 20% for your medical expenses out of pocket for your shoulder. So let's see if we can help you.
Perfect. All right. You see any other questions you'd like to? Let's see. I have a Tricare for life insurance to the VA and covers drugs for free. Yeah, the VA prescription drug coverage is really really good. So people that veterans, not necessarily Tricare, but regular VA, people that have the VA, um, if they sign up for a Medicare Advantage plan, to get their, Part B paid for or some other, benefits, other options, quite often they sign up for one without the prescription drug plan because the VA is able to negotiate their prescription drugs. So the VA
That's
has
right.
really, really good prescription drug plan.
And to squarely answer the question of whether they need to also add a standalone Part D prescription drug plan, you don't. Your VA prescription coverage is considered at least as good as what you would have received through Medicare Part D. So you don't need to worry about signing up for a separate standalone prescription drug plan.
All right, kind of a side question here. Michael, what is the website again for people on Social Security only to see if you need to pay income tax? It's in my description. If you look at my YouTube description, it's on there. The little tool, the link to the little tool is in there, and you just, answer 4 or 5 or 6 questions, and it tells you about 50% of people that receive Social Security benefits, they do not pay taxes on their Social Security benefits. So there is a YouTube guy that specifically talks about Advantage versus supplemental. He isn't a fan of Advantage plans. It really depends on your particular situation. I prefer Medicare supplement plans. That's why I always tell people, when you call Chapter anybody, you always say, "Hey, tell me about Medicare supplement plans. Tell me the difference between an N and a G, and if that is an option for me right now, in my particular state, in my particular situation. And if it's not an option, then there's no use of wasting your time. But if it is an option, then tell me about N and G, and what is the difference between Medicare supplement and a Medicare Advantage. Not necessarily against Medicare Advantage, because when I say I'm against it, I say, well, check Medicare supplements first. Then people say, well, Ed says if I can't get a Medicare supplement, then don't get anything. No, I would never say that, because if all you have is Medicare Part A and Part B, then unless you got a few $1,000,000 under your mattress, then you are going to have some financial difficulties in the future. So Medicare supplement, evaluate that first. If it's not for you, then Medicare Advantage. It takes a little bit more work. You have to check it on a regular basis, and you have to sometimes fight for the prior authorizations, and that's why we chose Chapter to help out, because if you have an issue like that, member success team, right?
That's correct. And we could talk about this question all day. The takeaway here is you need to work with an independent, unbiased advisor that can help you evaluate all of your options. And so they can discuss the trade-offs if you choose a Medicare Advantage plan, because as Dr. Ed mentioned, they're numerous. That said, Medicare Advantage still imposes a maximum out-of-pocket protector, whereas original Medicare does not. And I expand on this in my short book on Medicare. The title is It's Not That Complicated. But I talk about Medicare supplement versus Medicare Advantage till I'm blue.
Yep. Perfect. What about, this is a good question. What about Medicare through your pension or state? So there's some pensions out there that are kind of moving to Medicare Advantage. So, historically, after working in some place for 20, 30, 40 years, you get your gold watch at retirement, and they say, hey, we'll give you health coverage forever. They not really doing the gold watches anymore, but they're saying sometimes if the CEO doesn't steal all the money and head off to the Bermudas, I guess you have your health insurance forever, right? But what they're doing is some companies, they're not continuing the health coverage you had during work. Some companies are now switching you to a Medicare Advantage plan. And how do those Medicare Advantage plans compare to regular Medicare Advantage plans that anybody can get in that particular area?
It depends on the state. And it also depends how much the state is charging you in exchange for that retiree coverage. So it's important we can't make any sweeping claims because it varies state by state. Some of them are very strong. For example, the one in Ohio in particular is a very strong Medicare Advantage option. It functions similar to a Medicare supplement plan. But in other states, specifically the Southeast, they're hardly worth the paper that they're written on. And many retirees opt out of them for that reason.
Perfect. Oh, here's an awesome question. K. Paul, how can I report great care from a Social Security person? I called 4-minute wait. Awesome. Sounds like it's probably a relatively smaller office. She answered every question and was just so polite and caring. Awesome. I like it. So yeah, there are comment cards that you can download and send in, and or just if you don't have that, just just write a little note or something like that, or anything. I'm just just a little note and send it to that particular office and address it to the district manager. And what will happen is the district manager will read it and they will put it in that employee's file. They will definitely put it in that employee's file. And so, yeah, that'll definitely help out. So, yeah, I love to get those. So thank you very much for that. Please. Yes, it's tough out there for Social Security employees. They're losing all the most experienced people in their office. Those people are taking early retirement and moving out and whatever. So it's Social Security can only work with the resources Congress gives it. Social Security cannot hire people unless Congress says hire people. Social Security cannot update their system and their computer system until Congress people give Social Security the resources. And Social Security has been begging for decades. We need more staff. We need to update our computer system. We need to make the policies and everything easier. But Congress, they're no show. So unfortunately. All right, we are over an hour. Any final thoughts there, Ari, for our listeners?
Incredible engagement. I actually want to jump on my YouTube and start responding to some of these comments that we're seeing, because there are just so many great comments from your viewers today. So really a kudo to your audience, and thank you for watching us.
Yeah, anytime I do this, I have no life, but I do this every single day pretty much at this time. So if you're ever out there out and about, Ari, and jump in and you can answer any questions on the live chat if you want. Yep, we'd be more than happy. More than happy.
I'd love to come back soon.
All right, y'all take care. Have a beautiful day. And please, 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 as always, take care of each other.